So recently I had urology rotation, and this is kind of how I learned how to think about blood in the urine or hematuria. So hematuria can come from different sources. Sometimes it's benign. You can just have blood vessels, especially in the prostate, that bleed, and you can think of this as the equivalent to the nose bleeding, where you don't really have to do anything about it. It will stop on its own. Unfortunately, inside the bladder, inside the genitourinary tract, you can't really apply pressure to the area. So you kind of just let the bleeding stop on its own. Of course, you have to weigh the bleeding versus clotting risks if you have a patient that's on Xarelto or any anticoagulation for that matter. The other is stones. 1 in 6 Americans will develop stones. It's very common. And the trauma from the stone in the ureters can cause bleeding. This will then lead to workup of the stones. Ultrasound is best, but also CT can catch areas that the ultrasound misses, such as part of the ureters, the bladder wall as well. Next is infection from urinary tract, such as pyelonephritis, cystitis. These infections can cause blood in the urine. You can have clots inside of the bladder as well. And if the clots are severe, if the hospitalist or even the urologist, when they're flushing out the Foley catheter in, if they can't have dilution is the solution. If the clots and the fluid don't clear off after irrigation, they may have to do something called CBI or continuous bladder irrigation, where a machine automatically cycles fluid through the bladder and clears out the clot. Of course, when it gets that severe, you want to be checking. You want the patient to be hospitalized and be checking their blood regularly. Things you should watch out for are signs of hemodynamic instability like hypotension, tachycardia, anything that can represent hemorrhage. Lastly, blood can be from the dreaded C word, cancer. Cancer from anywhere in the genitourinary tract, such as renal cell cancer, bladder cancer, clear cell, or transitional. You can have cancer that needs to be worked up, most likely through a cystoscopy and ordering of different tumor markers. And that's kind of how I like to think about hematuria.